Hello and welcome to another exciting edition of a program of choice, Health Affair on AIT. It is a platform where we focus on everything that concerns your health, the challenges of women and children with a view to finding lasting solutions. I'm your regular anchor, Ushuomowa Daniels. On the program today, we shall be taking a look at emerging infectious diseases and the need for epidemic preparedness. But before that, let's take you through our news segment.
Despite the administration of more than 5 billion COVID-19 vaccines across the globe, many countries have continued to face steep increase in cases and deaths. Also, 75% of those doses have been administered in only 10 countries, leaving Nigeria behind with only 2% vaccination coverage, a situation the Director General of the World Health Organization says is unacceptable in a remark at the G20 Health Ministers meeting in Rome, Italy. Dr. Tedros noted that WHO's global targets are to support every country to vaccinate at least 10% of its population by the end of September 2021, at least 40% by the end of the year, and 70% of the world's population by the middle of next year, 2022, through the commitment and support of G20 countries who are the largest producers and donors of the vaccines.
Alimosho local government area, the largest local government in Lagos State, has continued to be a flashpoint for cases of rape and all forms of gender-based violence, despite increased advocacy. To nip this in the bud, these women rights activists decided to go out on the streets to sensitize residents on how they can protect themselves against the menace.
People tell you that it's because of economic situation that they are violent in their home. But when you are talking about sexual and gender-based violence, sexual violence, there's no reason why people are sexually abusing a child of 10 months or an elderly woman of 80 years. They have a reporting pathways where they can report their cases. We provide legal clinics where people will come and tell us what are their issues, legal issues, and I will provide solutions to it.
The rape or the battering of women and other, even not only women, the young ones among us, that it is already against the law.
The activists also expressed concern about the increasing cases of COVID-19 Delta variant and forced vaccination.
Coronavirus is a deadly virus that does not know age, race, or creed. So to that extent, it is good that people are being forced to take that vaccination.
I don't think people should be forced to vaccinate. Rather, they should be they should be told the reasons why they should vaccinate. Because it's also their right to say they don't want to.
Those who value their lives will come out and do it. But those who, I believe that they don't want to do it, it's not a force to me. It's a choice.
In a bid to reduce the spread of COVID-19 virus in Nigeria, there have been increased calls from different quarters on the need to enforce vaccination.
This year alone, cholera has killed more people than COVID-19. All that we have saved from COVID-19, we are losing them to cholera. And this is an avoidable outbreak. So we need to go to drawing table. If care is not taken, next year rainy season, we'll be speaking the same thing.
The head of communication, Nigerian Center for Disease Control, Dr. Yahya Disu there, speaking on the latest cholera outbreak across the country. Epidemic levels of cholera have been reported in over 24 states out of the 36 states of Nigeria, with more states expected to be affected.
We don't have good sanitation till date, and we have open gutter systems, and we have people drinking from public sources that are contaminated. We need to get to the root cause, and therefore proper disposal of waste, of human feces, of open gutters. We need to clear that all out.
There should be ways to treat already existing sources of water supply.
Cholera is a bacterial disease that causes severe diarrhea and dehydration.
Cholera is caused by a bacterial organism called Vibrio cholerae. You cannot see it, it's a germ. So you can only get this when it goes through your mouth into your system. And then it manifests by stooling and vomiting. Vomiting excessively and then passage of frequent stools, and which we call diarrhea. And it can kill in hours. So that's why we let people know beyond prevention of cholera, they need to quickly report in the hospital and then also take oral rehydration solution, salt sugar solution. That keeps them alive before they get to the hospital and receive treatment.
Cholera is usually spread through drinking of contaminated water and food.
There is need to correct the misinformation that Lagos State Chapter is only joining the national strike on solidarity basis. We need to re-emphasize and reiterate that even here in Lagos State, all is not well with us. And this is an avenue for the Lagos State government to address our local issues and challenges as earlier stated.
Days have passed into months since the industrial disharmony between resident actors and the federal government resumed, a situation that has left patients who depend on public health facilities across the country in anguish. Not even the threat of no work, no pay, and other efforts made could make any difference.
If you take a walk around the hospital, it will be clear that the services are extremely constrained, and we have very few patients and very few clinical activities going on in the hospital. The resident doctors in any tertiary centers hold sway and account for the majority of the activities in the hospital. So definitely, the hospital is very scanty.
As it is now, it is crystal clear that the government is not that sincere. You will have seen a lot of release from the officials of the government, but most of what is contained in that release are not true. They are not the true form of what is happening. Imagine being attended to by angry and hungry doctor. I don't pray that any one of us here should experience something like that.
There's always been promises. They've made commitments that this and this will be done. This was said last year. Likewise, early this year, it was promises that kindly return back to work or address this issue, and that resulted in suspension of the strike in April. Promises are yet to be fulfilled, and we can't continue doing the same thing and expect different results.
The best brains are leaving the country, and if this continues, we can all add one and one together, and we'll definitely know that at some point we'll have dearth of specialists, and the masses, unfortunately, would suffer for it.
Today is the medical doctors. Tomorrow it could become the nurses or the pharmacists or the radiologists and so on and so forth. So it is to sit down, and whatever agreements they sign with these people should actually be implemented.
Resident doctors across the 36 states of Nigeria resumed the nationwide strike on the 2nd of August 2021 to protest the removal of house officers from the scheme of service and other issues of unpaid allowance, shortage in workforce, among other issues that have been in contention since 2014. Human trafficking is a form of modern-day slavery which involves illegal trade of people for exploitation or commercial gain. According to the United Nations, the smuggling routes from East, North, and West Africa generate about $150 million in annual profit and $35 billion globally. In terms of human trafficking ratings, Nigeria ranks 32nd out of 67 countries with the highest number of slaves. Although the number of human trafficking victims outside Nigeria is largely unknown, it is undisputed that Nigeria, due to its high population, is routinely listed as one of the countries with the largest number of trafficked victims overseas. The increasing scourge of unsafe migration has highlighted Nigerians' challenge in this regard. Between June 2016 to 2017 alone, 602,000 Nigerians, according to a report by the United Nations, attempted migration to Europe via the Sahara Desert. 27,000 of these migrants died en route. Despite the risk of illegal migration, a number of young Nigerians still experiment with it, a situation many have blamed on poverty, lack of economic opportunities, conflict, insecurity, and corruption.
There was a survey done by World Bank some months ago. They said over 50% of Nigerian youth wants to leave the country, are interested in leaving this country. And that is true. It's even more than 50%, probably it will be 98%, because you will see that a lot of people are facing a lot of hardship, and they cannot cope. Not everyone has the stamina and the capacity to cope with the challenges they are facing now. So that is what is actually leading a lot of them. And going by the fact that the kind of infrastructures we have in Nigeria is not up to standard. You see that we don't have good roads, we don't have lights. A lot of people feel that outside attracts them more than inside. And that is what even the traffickers and the smugglers are capitalizing on, to canvas people. They now make outside look more attractive than Nigeria. So they now have upper hand because they know that the youths are tired and even families are also tired.
And then the consequence on that, the issue of unemployment. But the truth is that we keep telling them, you cannot run away from developing your country because there are a lot of things that you can do in Nigeria. There are a lot of programs that the federal government is bringing out that you can tap into. Most of you are fresh graduates. Most of the people going, some of them are fresh graduates, and some of them are school start dropout. But the truth is that you cannot take out poverty from some of these PVOTs, potential victims of trafficking, because that was part of the areas that we have discovered are mostly affecting them, especially most of the victims that are recruited from the rural areas. So, and because that is where the concentration of recruitment is actually coming up.
Young Mark Omozabi from Uromi, Edo State, is one of such Nigerians. In search for greener pasture, Mark found his way to Italy in 2017 through an illegal route. He was lucky to come back alive to Nigeria in 2018 after the many ordeals he had to go through.
From the beginning to the end, it was so tough. Let me just start from Kanu, where we enter bike and a lot of things happen there. From there, so they take us to desert. And when we get to the desert, in fact, I think we are 26 in Philos, but out of that 26, before we deliver, was 5 people. 5 people died, and not just only 5 people. When we were going, we meet a lot of people road that die, a lot of Africans. They are crying for help because that place, you can't go back. The only thing you can do just for you to rap on with your driver. And those drivers, they don't care. They rape our girls, they maltreat our men. And if you abuse them or you talk anything that maybe you speak English that they don't understand, they can try to kill you. Maybe they say that, oh, you want to escape. And secondly, what motivates me or what makes me to travel to that Libya land is through my friend, because I'm a stylist and also I manage a salon. So he was telling me that I can buy very well, and if I go to Italy, although I'm not going to Libya, but I was just passing by. So if I go to Italy, I will make more money, and when I get there, at least I will be earning more money. So from there, I was like, okay, fine. So I walk. He was telling me that if I want to come under 3 days, I will get there. But that 3 days, as I'm talking to you, I spent 2 years and 5 months over there. Even I used 7 months alone for prison because I passed through a lot. Many things happen. From there, even to call him, I can't call him, and a lot of things happen. But because I can't even reach my parents, nobody to reach. And there is what we call Burger, which is the trafficker, the person that took me there. And I was there suffering, and he was here in Nigeria calling my mom and dad to pay money that I will soon get to Italy, and I'm there in desert suffering. So he collected a lot of money from my mom. He would just call my mom that, I want to cross to the other side by this time. And if my mom don't have the money, we go ahead to go and borrow it. Is when I decided to come back through IOM. When they asked me, I said, I want to go back. So it's when I decided to come back. When I called my mom was like crying, say, look at money they used to collect from them. A lot of things happen in that place that if I should remember, I won't be in a good mood. It's just a sad mood to me and it's an everlasting memory to me. That place is a dead place. It's not a place that somebody need to go. Because the reason I come back, because if I should not come back, that means I won't be alive today. Because a lot of things happen. If somebody wants to die, nobody can tell anybody. In Libya, yeah. So many things are, even in prison, we can stay in the 1 week without even food, and they'll still be beating you.
Apart from the victims being forced into all manners of dehumanizing jobs, the harvest of human organs has become a source of worry.
You know, when you talk about trafficking, it has to do with exploitation. It has to do with selfishness. Somebody wants to deal with you to make money. It doesn't care what you go through. Whether you die or you are alive is not his or her business. So that is why you see some of these things coming out now. And most times our youths, young people, they know, but they still want to venture. They sell hearts, they sell kidney, especially kidney. Kidney is the highest. You know, liver, they transplant some of these things because they use them for transplanting. You know, and you saw the recent report about last week, where I think from NAPTIP, when they said the international, some countries in Europe demand for private organs of African traffic victims. You know, so it's an issue.
Some of them do not know they are going to harvest their organs. It is when they get there, they are put through a lot of sedative, and before they know what is happening, one of their kidney or one of their organ is taken away. So it's not as if they actually elect to do that, or they actually choose to do that. Most of them don't. Whatever happens to them at that point, they are ignorant of it. It is when they now wake up after being put on sedation, that is when they now realize that, hey, so thing has happened to me. But the truth is that we must all salvage this country because a lot is going wrong, especially with our youth and the young ones. So that is why the federal government is crying, the NGOs are crying, other law enforcement agencies are also crying, the FBOs, the CSOs are also crying that something has to be done.
As far as you are in Nigeria, no, not just Nigeria, Africa. As far as you are in Africa and they are tongue everything, they'll just answer you, they'll just say you. Okay, the next thing, they'll just call people, say they have market business, they call us business, they have business there. They used to sell men, sell women, and a lot of things really happen. Most time in the prison, when I was in prison, I remember this person's name is from Ghana. It's Ghana or Gambia. It's Mustafa. When the person was like fighting with the person, because the person don't have no choice. It's like his hope is lost. No, the person like it's okay. Do you know what the Arabs say? Actually, if they are speaking their language, I don't actually listen to them because if they know that you are in their language, they will not talk secret thing. So the word they told the person say they should take him to desert to go and harvest and a kidney. After they harvest kidney, they will kill him. It's better for it's of them for me and them to lose. It's better for only the person to lose than to go and set kidney and the person die. It's not that concern. And also for prison, there's one woman that gave birth, and this woman, when this man gave birth, we just tell the man that please look at somebody that want to give birth. They say no, there's nothing concerning. Do you know what is Sandy? There's one Sandy there. That's let's remove on Sandy. Yeah. That's what we used to call the baby. This thing after the birth, but the woman died. Inside the same prison.
Majority of victims who are lucky enough to get back to Nigeria alive are usually traumatized and mentally unstable, and thus requiring rehabilitation. Although there are a number of governmental and non-governmental organizations working actively to stop this menace, not much has been done in the rehabilitation of male victims. It is the desire to fill this gap that PCI Male Shelter was birthed at number 20 Godwin Iyamu Street, Isoto Ayobo Command, Lagos, Nigeria.
I observe that our young men, when they return back, there is no provision for them. They don't have anywhere to go. And this thing has contributed a lot to the remigrating. Some people, after they have come and they didn't have any hope, they will go back. They will find one African country and go. They don't care what they are doing there. Some, they will look for a way, get their support, and also find a way and go. Or they get frustrated, they misuse the opportunities they create for them. So I now look at it and say, no. If international community is bringing support for these people, how do we sustain it? How do we make it valued? How do we make it so that these young men this thing can be useful to them? That's what I came up with this shelter. Then in the shelter, we have a training facility outside there, 2 classes. Those people who will be here will undergo some level of training. Mentorship training, psychosocial training, emotional trauma healing, different things. Then after that 3 months, those that want to go, that don't have serious cases, we can look at how we can link them up with opportunities. You understand? Maybe to get some little job or to go and learn 1 or 2 things or to start up a business within close monitoring so that they can be stable. There are some persons, if they don't have support to come back mentally, they can take their life or they can decide to go into drugs. They can decide to go into crime. That's why you see that it is very easy for some people who have gone through this journey, when they come back, they become criminals or they become drug addicts. So with this process that we have set up now, it will be easy to get a number of people who will come out positively. We have psychologists, we have psychological experts, we have them. Partner with the Ministry of Health. We also partner with the health sector, the health section of the IOM, even the NAPTIP. You know, they have all these health departments. You know, then on our own, we have experts, but because we have a kind of national referral mechanism policy, you know, that guides shelters. These things are very easy to come by. Emotional healing process and mental healing process. We have psychologists, we have psychosocial experts that will be here. Because like I said, it takes a period of time for someone to come back to normal self before it can be launched back into the society. It's for people, for vulnerable groups. And anything that has to do with vulnerable groups does not require money. I have somebody who has been here for the past 4 months. He returned from Algeria. He traveled to Algeria at the age of 5 with a mother, lost the mother, and decided to come back. He's a Nigerian, but he can't even speak English very well. He has been here for the past 4 months. I've been feeding him with my own personal money. He's sick, I will send something to him. So that is the essence of this shelter. So we don't require money.
During the unveiling on Thursday, September 2nd, 2021, some development partners and invited guests had a lot to say about the 40-bed space facility.
I think this is a really important project. The IOM has been implementing this project with support of the United Kingdom, and the project has been focused on advancing and providing sustainable reintegration support and victim-centered support to those who are vulnerable, those who are returned from various countries along the Central and West Mediterranean route. This is actually one part of the program. One of the outcomes of the program was to enhance capacity of shelters, of service delivery actors to actually respond to the needs here on the ground. And this is a very important step forward, especially because there's quite little capacity to actually absorb and to provide support to male victims of trafficking. So I'm very glad that we're here today and that we have managed to work together with the PCI to establish and strengthen this shelter.
Now, this is very unique in the sense that in the past, all attention has been focused on female survivors. But because the executive director of PCI and the initiator of this good idea was also a returnee who has decided to make maximum utilization of his experiences to appeal to both state and non-state actors to ensure that there are interventions that support survivors. From his experience, he discovered that a lot of young men are actually neglected and not provided with the services that they ordinarily require to be able to manage their trauma and the experiences they have encountered while in the desert. So having this shelter will help, first of all, to provide counseling services, trauma management, proper reintegration, as well as skill acquisition for these young men who, for one reason or the other, found themselves as either victims or survivors of trafficking in persons. And then he has also been a trainer, training returnees from different parts of the world. Across Nigeria, he has gone around Nigeria to train these returnees on several skills, provide them with opportunity to reintegrate back into the society. So you can see that he's coming from a background where he has seen both sides of it, out of Nigeria and within Nigeria. So I must say that this is a laudable initiative that we commend, and then also commend all the partners that contributed to supporting the establishment of this male shelter.
Reintegration of these victims, empowerment of these people is a whole lot of process. And for them, the moment they come back and they are rescued, especially some that are return migrants, they need a place to, first of all, stay. And that is mostly like our own shelter is a temporary shelter. But what we are celebrating here today is also an added advantage to the agency and most of the NGOs that are actually in the course of fighting the scourge of returned migrants and returned victims of trafficking.
All that glitters, they say, is not gold. So, for anyone who has the intention of traveling abroad illegally, please think twice.
Once upon a time, I lost hope in this country, and I once decided to run out of this country. I found myself in the Sahara Desert. And after that experience, I never believed that the grass is greener, because since I came back, putting my feet well on ground in Nigeria, I can say that if you put your heads together in Nigeria, you can face the challenges. So I don't believe that the grass is greener outside there. They might have more infrastructures, they might have more things that in terms of that can attract people. But Nigeria is actually a country that I feel, for me, I am free. And I can express myself anyhow I want it. I graduated from University of Benin in 1998. I studied industrial mathematics. And for a few years after my study, after my youth service, I started business. I was into this car because I was staying in Benin. The popular business there is going to Cotonou and Benin Republic to bring in cars, which I learned it immediately and I started doing it. And I had trusted people who entrusted their funds to me to help them buy cars, and I was making profit. After some time, the business crumbled, and I became frustrated. And the option was to live out, go to Europe, because I've been having advice from friends that you will make it easier. Why are you suffering yourself? With your capacity, Osita, you will know you with your capacity. I will know that when you go to Europe in 6 months, you will become a big man. And at my level then, being frustrated that period, that my status, that was the only option I had. But my option was not even to go to the Sahara Desert. My option was to travel. I bought a ticket, I got to acquire the visa, unknowingly that the visa was a fake visa. And I got to the airport, I was turned down. It was even God that saved me that, I was not arrested by the security agents. But I was turned down. And I started accusing the people that organized it. I didn't know it was fake. So from there, the following day, that was when I found where I had a call, through a relative, that some friends are there, I shouldn't waste my time. That there is a job in Europe, in Spain, that in 5 days' time we should be in Spain, that they will come and pick us up by flight to Morocco. I couldn't ask anybody questions. The danger in this is when you're desperate, you may not be able to even ask people questions. Your mind will be so carried away that because you have lost hope. I couldn't ask any question. The next day I went to meet them, then in Asaba. I left Lagos, went to meet them in Asaba, and I actually met them waiting. That were going to travel, about 9 of them, I was the 10th person. After about 4 hours, we left to Kano through these luxurious buses at the Onitsha Park. And that's how I found myself in the Sahara Desert. And the journey, I couldn't turn back because I've already engaged myself. And the journey is you don't turn back easily, because as you are going, you are becoming frustrated, you are becoming stranded. You can't return back. And the fact that a lot of people have put their hope in you that you have left the country. You know how it is. You coming back, and the people with you who are the lead or the guide, they will keep on encouraging you, making you feel that in the next 30 minutes you are in the next state, in the next 50 minutes you are in the next state. And because you are anxious that you are going to get to Europe, you will continue moving as long as you have the means. That's how I found myself in that journey. No, we spent quite a lot of days, because during my time, what we used was combined. This 911 truck, not these days they are using tailors. That one takes over 3 weeks, 1 month. It takes over 1 month. Because from one state to another, it can take you like a week plus with the truck, and it moves very slow on the sandy areas. So the journey was terrible. When I came back, I wrote a book. I titled it Chasing a Mirage, My Search for an Oasis. It was an experience. It was launched 2012, because I decided to document it so that I can use it as an information tool to create awareness for some other younger ones. Because the truth is that if people like us have had enough information, no matter the kind of frustration, I don't think I will fall into that. So I feel that one of the key to ensure that we reduce some of those journeys is to scale up the level of information that we are giving.
We have to also talk to our parents. They need to watch out for their children, especially the kind of peers that they keep, the kinds of friends they associate with. Our phones now has become a means of recruitment for the victims, for the young ones, has become a means of recruitment from them. What we are witnessing these days, especially when some of these returnees when they are received at the airport, most of what they tell you is that I was chatting with somebody on my Facebook. I was chatting with somebody on my WhatsApp. Somebody you don't know. So a lot of recruitment takes place through the social media now. And that is what the social media are meant for good, but they are used for a lot of terrible things. And most of them, we keep telling them, some of them when they come back, their health is no more there. Some of them comes with HIV, STDs, all manners of disease. Because before we take them into our shelter, we screen them, we take them for medical tests. And some of these things are revealed, hepatitis B and all the rest. So these are some of the things they come back with. And the irony of it is that they don't even come back with any money. And we keep asking them, okay, of what use is the journey that you made now? What have you brought? How much do you have? They don't have anything to show. So parents are culpable. Some of them are even aware of what these children are going through, and they still give their consent for them to go. So this is the noise we are making. It is wrong.
If you cannot achieve it to travel legally, stay back in Nigeria and open your eyes to the available opportunities to make it big. Welcome back. The world is currently battling the COVID-19 pandemic. In most states across Nigeria, cholera is ravaging. Lassa fever, meningitis, and lots more are endemic in Nigeria. And with a closer connection between the human and the animal kingdom, more zoonotic diseases are expected to come. In a bid to help Nigerians prepare, I spoke with a cross-section of public health advocates on epidemic preparedness at a workshop recently in Lagos.
How do we ensure accountability at all levels? And how do we even measure this accountability towards the progress of strengthening the overall health security landscape in Lagos State? As we all know that Lagos State is the epicenter of this from 2015, the Ebola, till now. So, and without us actually having the right structure and the right environment, how do we withstand this? I learned that in another place in West Africa and Guinea, there's another Marburg virus now. So how are we preparing ourselves to be able to withstand and protect ourselves? Because the health of Lagosians is in everybody's hands, and especially in the hands of the CSO and the media, because you are the voice, not only of the people, you are the voice for the people. And so we are here to actually get to understand what are we to do? And we are here to even map out a plan, because they say if you fail to plan, you plan to fail.
Yeah, one of the key things we need to understand is there are challenges in health. Now we have COVID-19. Before we had HIV, AIDS. Then we have Lassa fever, and a number of other, diseases that affect a huge number of people. And it means that we need to be prepared. The Boy Scout says, be prepared. Because at any point in time, something may happen. Meningitis is a major issue. We know the period meningitis, strikes in Nigeria. But are we prepared for it? Are we strategizing in a way that at the end of the day, we are able to address, that issue, so that at the end of the day, we save lives. And for us to prevent epidemics, it means that we need to be prepared for it. We need to plan for it. If you don't keep your environment clean, cholera may come in. If you don't do the needful, there are certain things, certain steps that everybody needs to take at any point in time in a way that you can protect and prevent challenges that has to do with health around your family. Malaria is a major issue. Yes, it's not an epidemic, but there are certain things that happen that reoccur year in, year out that we need to prepare about. COVID is a major issue. But when it came, we were talking about palliatives rather than addressing the laid down public health principles that can help us address those issues. So those are some of the things that the media need to know about in terms of educating the public. Letting people have information at their point of need is very important. Because if you don't have the information, you can make mistakes. And these are things that we need to constantly have at the back of our mind. Why are we using the face mask? People are in buses, Danfo, and all those things. They don't use face mask. Some people even disbelieve. But when COVID strikes, you can't even think through before it brings you down. And this life is just one. And these are things that the media has the capacity to look at what is going on. But not just media. Media need to look at it from the point of research, from the point of science. When we talk about epidemics, we are talking about issues that has to do with medical science. There has to be a core understanding of these issues. We need to equip ourselves in a way that at the end of the day, we understand the principles behind diseases, the principles of public health that can help us address those issues. And our stories or our analysis need to be relevant to people. Because if it's not relevant to them, they tune to another channel.
It's obvious to everyone that the global climate is actually shows all of us the importance of actually being prepared for epidemics. We saw, for instance, in America that there had been some preparation before under the Obama regime, which was not continued under President Trump, and we saw the implications. In Nigeria here, we saw that Lagos is always the epicenter of any good and otherwise that comes. We saw what happened with Ebola. We saw that it was just one, there was a good reaction, quick reaction from the state, and including sacrificial offering of life even by Dr. Adadevo. And we saw that now with COVID, the last few years, since last year, we saw the impact it has had on even on the economy. So it's a critical aspect for us to actually make sure that all finances, funding, to ensure that our biobank facility is actually functioning, so that we can actually do proper research, ensuring that we ourselves should be able to provide vaccines for our people. We should not always wait to like beggars, waiting for people abroad to bring vaccines to us before we can actually deal with our own health. So health security means we should be prepared, we should own our health systems, and we should understand that now with the zoomorphic nature of diseases, that means disease coming from the animal kingdom to humans, increasingly all these diseases coming are from the animal kingdom to our side. It's going to increase more and more because of issues, climate change, of issues of human interference in the animal climate environments. It's increasing more and more, and we have to be prepared because we see the devastating impact it has had. We see even now speaking, we have Lassa fever happening, we have cholera happening. So it's not something that will go away. We have to be prepared to ensure that whatever epidemic comes next or pandemic, we actually have everything in place. We have our facilities in place. We have the funding mechanism. We have the response. We have our protective equipment in place, testing centers. These are all things that need money. Now we're hearing of procurements about over 60 billion. They want to procure vaccines. That's a huge amount, considering that our whole basic healthcare provision fund is even half of that. So we need to understand the importance of actually ensuring that we have things in place so that it's not until the pandemic bursts out that we start running around looking for where to procure vaccines.
It's beyond COVID-19. It's just that COVID-19 just brought it to light. We had the Ebola virus. The way it can transmit from person to person, right? The Ebola virus, cholera, you have the various poxes like chicken pox, the monkey pox, so even meningitis, all of these, tuberculosis, all of these can become public health emergencies of extreme proportions that become epidemics locally. And what we simply mean by preparedness and response is to look at what we have in place. We have global benchmarks, and we even have local benchmarks. We have the National Action Plan for Health Security, for instance, that has been developed along international health regulation guidelines to bring the focus to and to help Nigeria as a whole and each state to prepare, right, to tackle public health emergencies, to tackle epidemics. Naturally, when you want to tackle situations like that, funding is important. So in every public sector institution, health sector, we need financing. And what the response means. Preparedness simply means ensuring that we have the structures, the financing, the mechanisms in place to tackle epidemics preparedness. And response means that we are well equipped on ground. We have the right human resources and adequate human resources. We have the right equipment. Every infrastructure that we require to tackle it and ensure that it doesn't spread. Transmission is managed and nipped in the bud, right? And that's what we mean by being prepared to do. I think that the government has laid out, I know that the government has guidelines, right, for every individual within this country to abide by, to ensure that, for instance, COVID-19 or epidemics are not spread. For the individual, is basic. It says, when you go out in public places, mask up. It says, maintain social distancing, right? It says, wash your hands regularly, right? And where you don't immediately have access to water and soap, then use hand sanitizers. Just be aware and be alert that epidemics is real, COVID-19 is real, and follow the guidelines, basically. Keep clean environments, right? For epidemics generally, ensure that your environs are clean. You maintain good hygiene, good sanitation. Basically, if you know that someone is sick, if you're sick and you have symptoms that are similar to those that have been talked about concerning each epidemic that we are aware of, like cholera, like Lassa fever, COVID-19, then contact the government. The lines have been disseminated and are still being disseminated. Contact them to help take care of you, because that is why they are there. If you know that someone else is sick, you could also help to contact the government.
If you're just joining us, it's Health Affair on AIT. Now we'll be taking you to our nutrition segment.
The carrot is a root vegetable, usually orange in color, though white, purple, and other varieties of colors do exist. People have been eating carrots for over 5,000 years. The plant, according to researchers, originated in the Middle East and Afghanistan. Carrots was originally cultivated for its leaves and seeds. Carrot is a nutrient-dense root rich in antioxidants, fiber, beta-carotene, other vitamins and minerals. Consumption of carrots is good for vision, promotes hair growth, weight loss, regulates blood pressure, lowers cholesterol levels, and helps eliminate toxins from the liver.
On our clinical segment, we'll give you powerful tips to stay healthy.
As I speak, there is no drug that directly affects the virus. What we do in the isolation center is to treat people based on their symptoms. We offer them supportive care, we give them oxygen if they need it, and then dexamethasone can be given, which helps to reduce the inflammation of the lungs.
Please join us on our perception segment. Your opinion counts to improve human lives and the nation's health sector.
The doctors, as far as I'm concerned, needs to be paid more adequately. If our politicians sit in the National Assembly and State House of Assemblies and they earn fat monies, how much more the doctors will cater to the needs of even the people at the grassroots level. And so if we really would want some level of improvement and not having other countries come into the country to take away our doctors, we need to look at how we pay them, make it international standard for them to be able to say whatever it is my counterpart is getting abroad is the same thing I'm being paid here. Give them more resources to be able to work with, provide more infrastructures for them, conducive environment. I believe whatever they are agitating for is totally not out of place.
This is the much we can bring you today on the program. Thanks for spending your time with us. Please, let's do it again same time next week. My name is Ushuomowa Daniels. Please keep staying safe.